Hi, this is Araceli Aguilar. I am going to introduce you to an awesome field, a career path that takes a lot of dedication and compassion. It is the field of nursing. I have been personally a registered nurse for 8 years. I have 2 years experience in med-surg, which is your basic medical surgical unit that involves and takes different kinds of patients with all kinds of diagnoses. I also have 2 years of critical care experience. I am a critical care nurse, or coronary care nurse, I should say. I would take open heart patients after their surgery and recover them in that 24-hour observation period to where they're very critically ill and very touch and go kind of prognosis. I also have been a nurse manager. I managed 3 departments. I have managed a regular med surg a cardiac floor, specialized in patients that came in with heart attacks. I also managed the telemetry department. That department involves telemetry technicians that read heart monitors, and they relay that information to nurses. And I also manage the hemodialysis department. Dialysis and coronary artery disease are pretty much similar, as in dialysis involves more of a renal disease that can come from being having impaired circulation because of heart disease. I also did, after management, I did 1 year of hospice care. That involves a specialization of nursing skill to be able to create that comfort and compassion for a patient that's going through their end of life stages. So I did have to manage a lot of patients that were getting ready to make their exit. Also, I did what I'm currently doing right now is post coronary care nursing. We take care of patients that are not as critical to be in the ICU. However, they are more ill and not as stable to be on a regular floor. So, a little bit of nursing history. Everything goes back to a nurse, a female nurse who was a war nurse that by the name of Florence Nightingale. She was a nurse during the Crimean War. She was a nurse educator. She opened the first Nightingale School of Nursing in London, and she's commemorated by giving us what we call Nurses Day, which is May 12th. And it's an International Nurses Day, so it is actually celebrated all over the world. And it pretty much celebrates her birth and commemorates her healthcare education that she was involved in her time. Now, as far as nurse education, schooling that we need in order to be able to become nurses, there is a 2 year degree, which is involves your associate's degree. And what that involves is 1 year of prerequisites and 2 years of a accredited program. And then you have your bachelor's degree, your BSN, and that is again a 2 year program with 2 years of prerequisite courses. Next follows the master's degree, and after your BSN and you obtain your master's degree, you can specialize in 3 different fields. You can specialize in nurse education, nurse leadership, or nurse practitioner. So that is available here at TAMUCC. Everyone always wonders what the starting salary of being a registered nurse is. Starting salary of registered nursing involves $55,000 to $60,000 a year. I won't tell you exactly how much I make, but I do make 6 figures a year just because of how much I work and the fact that I work different aspects in nursing, including nurse education. Different departments that you can work in nursing can involve more categorize nursing. The first one would be bedside nursing. That's your med-surg floor, your ICU, your OR, and your emergency room. Next would be your special procedures nursing. That's more nuclear medicine, endoscopy, cath lab. Those are your special procedures. Nuclear medicine can involve stress tests to, measure heart function. Endoscopy is usually where we can look inside, to make sure someone's gastric, everything's working as far as like their stomach, their intestines, and things. Cath lab is another heart special procedures area. There's also hospice. We have home hospice versus inpatient hospice. That just gets that patient ready for end of life care. That nurse would be taking care of those kinds of patients. We also have home health services, to where we go out to the patient's home instead of them coming into the hospital, and we'll provide quality care there. There's management and also quality management, just to make sure that we're giving the appropriate amount of care and in the best quality that we can. Along with everything, you can get certified and licensed in all kinds of things. I currently have my ACLS, BLS, TNCC, PCCN, CCRN. Those are all just certifications that I've obtained during my career that show that I have specialized in certain areas of nursing. Nursing is the best thing that I think I could have chosen. My personal goals as a nurse is to, again, get my master's degree in nurse education and get a minor in leadership, so that way either I get to teach nursing at an accredited school, or I get to run my own hospital. And then right now, my after nursing, my future goals after that is to go to medical school and actually become a cardiologist. 12 more years of school in order to get that one in, but I hope you do choose to become a nurse. It is very gratifying, and it is for sure a very, very great experience to be able to take care of somebody and then also be thanked for it. Okay, thank you so much for your time, and I hope you enjoyed my introduction to my field. Thank you.